Welcome to the USMLE Step 2 Clinical Skills Examination Orientation video. This video will be shown to you on the day of the exam as part of the orientation session before the exam begins. Step 2 of the USMLE assesses the ability of examinees to apply medical knowledge, skills, and understanding of clinical science essential for the provision of patient care under supervision, and includes emphasis on health promotion and disease prevention. Step 2 ensures that due attention is devoted to the principles of clinical sciences and basic patient-centered skills that provide the foundation for the safe and effective practice of medicine. Step 2 CS uses standardized patients to test medical students and graduates on their ability to gather information from patients, perform physical examinations, and communicate their findings to patients and colleagues. Every encounter may not assess all of these skills. The examinee instruction sheet will clearly indicate what should be done for each encounter. You must bring your scheduling permit and an unexpired government-issued form of identification that includes a photograph and signature, such as a current driver's license or passport. If you do not bring acceptable identification, you will not be admitted to the test. Wear comfortable professional clothing and a clean white laboratory or clinic coat. The only equipment you are permitted to bring is an unenhanced standard stethoscope. If you forget to bring a laboratory coat or stethoscope, one will be provided. However, the number of coats and stethoscopes available at each center is limited, and it is recommended that you bring your own. All examinees will be required to remove eyeglasses for visual inspection by the test center administrators. These inspections will be brief and will be performed during the check-in process. Hair accessories are subject to inspection. Examinees should not wear ornate clips, combs, barrettes, headbands, and other hair accessories. Examinees wearing any of these items on the test day may be asked to store such items in their locker. Personal items. You will be provided a locked space to store items you will not need and will not be able to access during the examination. Items placed in locked storage may not be accessed until the examination is completed. You will need to keep your identification and cash or one credit card with you at all times in case of emergency. Before the exam begins, proctors will ask you to check your pockets, including your pants or skirt, shirt, and lab coat inside and out, to ensure that you do not have any unauthorized items. The proctors will ask you to put unauthorized items found into the locked storage space. If there are personal items you wish to access on break or during orientation, for example, a toothbrush, please leave the items at your seat. Personal items that may not be brought into the exam, accessed during break, or left at your seat include pens, cameras, recorders, examination notes of any kind, reading materials, watches, jewelry, excluding wedding or engagement rings, cell phones, pagers, tablet PCs, iPods or media players, fitness and tracking monitors, purses and wallets. Any device with transmitting or receiving capabilities, for example, Bluetooth. Medical equipment other than a standard stethoscope, that is, a stethoscope without any kind of enhancement such as digital or electronic amplification or any other enhancement. Failure to place unauthorized items into the storage area will be considered irregular behavior and will be reported to the USMLE Secretariat's office. Unauthorized items will be confiscated. On the day of the exam, your final opportunity to visit the storage area will follow this video. Many types of medically necessary personal items are permitted in the secure areas of the test center, subject to inspection by test center staff. A complete list of pre-approved personal items is available on the USMLE website, along with instructions for how to request authorization for an item that is not on the pre-approved list. If you require such an item and did not request permission in advance, speak to a proctor immediately after the conclusion of this video. On-site orientation. The on-site orientation session will include time for you to try out the diagnostic equipment available to you in the examination rooms. You are responsible for knowing how to use the equipment. You are strongly encouraged to familiarize yourself with the equipment during the orientation. The examination. The complete exam process takes approximately 8 hours and includes 12 patient encounters. There will be a 10-minute break after the third patient encounter, a 30-minute break, which includes a light lunch, after the sixth patient encounter, and a 10-minute break after the ninth patient encounter. Smoking is prohibited throughout the centers. Each Step 2 Clinical Skills Testing Center simulates a large medical clinic. In the course of the examination, you will go through 12 exam rooms, and you will encounter a different standardized patient portraying a different case in each room. Each encounter begins with the examinee instruction sheet, which is posted on the exam room door. A copy of the examinee instruction sheet is also available inside the exam room and on the patient note interface. The instruction sheet includes information about the patient in that room: name, age, gender, and the reason for coming to see the doctor today. It also includes the tasks expected of you, so please read the instructions carefully. The instruction sheet typically includes vital signs, which you should accept as accurate, and which you may repeat if you feel the case warrants that confirmation. However, if you do repeat the vital signs, continue to use the vital signs originally listed in the examinee instruction sheet for the purpose of developing your differential diagnosis and list of diagnostic studies on your patient note. All announcements are made over the public address system. This is an automated system that maintains the official timing of the exam. After the proctors place you in front of your exam room door, you will hear a faint announcement coming from inside the exam room that will say, "SPs, please prepare." There will be a brief delay, and then you will hear the announcement, "Examinees, you may begin your first patient encounter." This is your first opportunity to review the examinee instructions and to write on your blue scrap paper. Do not slide the examinee instruction panel and do not begin writing until you hear the announcement to begin the encounter. Patient encounters. You will be permitted 15 minutes for each patient encounter, starting with the announcement to begin the encounter. Read the instruction sheet and then knock on the door and enter the room.
Come in. Miss Grant? Yes.
Hi, I'm Audrey Baker.
I'm a fourth-year medical
Hi, student. How are you?
You may introduce yourself however you wish, as either a medical student or as a doctor. You may introduce yourself using your real name. Do not mention the name of your school or institution. Your role during the examination should be at least that of a first-year postgraduate resident physician with primary responsibility for the care of each patient. You should treat each patient you see as you would a real patient, communicate in a professional and empathetic manner, being responsive to the patient's needs. Do not defer decision-making to others. It may be helpful to think of yourself working in a setting where you are the only provider present. For most of the 12 cases that you will see, the patient will be in a gown. In some cases, however, a physical exam will not be required and the patient will be wearing ordinary clothing. He or she will remain enrolled throughout the entire encounter. Please do not attempt to communicate with the standardized patients outside of their patient roles. Telephone patient encounters. You may have a case in which your interaction is conducted by means of telephone. In these cases, there is no patient in the room, and data gathering will not involve a physical examination. If you have a phone case, follow these instructions. Do not dial any numbers. To place the call, press the yellow speaker button. To end the call, press the yellow speaker button. Do not touch any buttons on the phone until you are ready to end the call. Touching any buttons may disconnect you.
Hello?
Good morning, Ms. Bingham.
Hi.
My name is Jim Smith. I'm a fourth-year medical student. How can I help you today?
Only one call is permitted. When you hang up, you cannot call back. Again, a physical examination is not possible in this format. However, for these cases, as for all others, you will have relevant information and will be able to take a history and ask questions. As with the other cases, you will be given 15 minutes for the encounter and 10 minutes to record the patient note. Because no physical examination is possible for telephone cases, leave that section of the patient note blank. Tablet encounters. There may be one encounter in which the standardized patient provides an image on a tablet device. This image can be enlarged. A sample tablet is available in the orientation room. You may not take the tablet out of the exam room. Other encounters. If you have a case where the primary task is to assist with making decisions and/or with disease or problem management, the examinee instructions will note that a physical examination will not be required. The examinee instructions will also note that the differential diagnosis section of the patient note does not need to be completed. Remember that you should always follow the examinee instructions specific to each case. Taking a history and performing the physical exam. The elements of the history and physical examination necessary for each case will be determined by the nature of the patient's problem. You will not have time to do a complete history and physical examination on every patient, nor will it be necessary to do so, as indicated by the examinee instructions. In fact, if you attempt to do so, you may run out of time and will not be able to fully address the patient's needs. You will be expected to communicate with the patients in a professional and empathetic manner. As you would when encountering real patients, you should answer any questions they may have, tell them what diagnoses you are considering, and advise them about any tests and studies you will order. Perform the physical exam maneuvers exactly as you would for real patients, respecting their comfort and modesty. Female patients will be wearing bras, which you may ask them to loosen or move if necessary for proper examination. Do not perform rectal examinations, internal pelvic exams, genital or genitourinary examinations, including inguinal hernia exams, female breast examinations, by which we mean palpation of breast tissue or nipple, corneal reflex examinations. Any of these maneuvers may be ordered as part of the diagnostic studies if you feel they are indicated. Do not swab the standardized patient's throat for a throat culture. This can be ordered on the patient note as part of the diagnostic studies. All other examination maneuvers are completely acceptable, including femoral pulse exams, inguinal node exams, and axillary exams. Some physical exam findings might be simulated. Accept any physical findings as real. If postural vital signs are necessary for a case, they will be provided along with the other vital signs on the examinee instruction sheet. Keep in mind that the patients are subjected to repeated abdominal examinations. Avoid very forceful or deep palpation. You will be able to obtain the information you need without being unnecessarily forceful in palpating, percussing, or carrying out any of the physical exam maneuvers. Areas of special concern in regard to unnecessarily forceful examinations include abdominal examination, examination of the gallbladder and liver, thyroid and neck examinations, eliciting CVA tenderness, and examination of the ears with the otoscope and throat with the tongue depressor. These exam maneuvers are permitted, but do not be unnecessarily forceful in performing them. Equipment. Each room has a small stool or chair for examinees to sit on if they wish. There is only one blood pressure cuff size in the room. It will fit all our patients. The ophthalmoscope should come on when you lift it off the wall. However, if it does not, there are a couple of things to check. The dimmer switch is in the handle. It is possible that the examinee before you may have inadvertently left the dimmer switch down, so check that first. It is also possible that the previous examinee may have turned the power switch off. The otoscope should come on when you lift it off the wall. Again, the dimmer switch is in the handle. Please use care when examining the ears with the otoscope. The otic speculums are disposable. Throw them out after use. There are 2 wall clocks in each exam room. They can be used to assist in managing your time for each patient encounter and can also be used to recheck the vital signs of the patient if you feel a recheck is warranted. The official exam timing is maintained by the automated announcements. You will hear an announcement when there are 5 minutes remaining in the patient encounter. There are 5 minutes remaining in this patient encounter. You can turn off the large overhead light with the wall switch. When that light goes out, a smaller light will turn on so the room is dim but not completely dark. On a shelf you will find tuning forks and reflex hammers. There are jars with tongue depressors, cotton balls, and cotton-tipped applicators. There is also a jar of toothpicks for testing pinprick sensation. Throw them out after use. The sink area includes soap, water, alcohol wipes, paper towels, and a cup dispenser. The water is drinkable. There are also boxes of latex-free gloves. Before each examination, please wash your hands with soap and water, use hand sanitizer, or wear gloves. Hand sanitizer is located on the wall near the door of the exam room. If you use hand sanitizer, be aware that you should not touch the patient while your hands are still wet, especially near the patient's eyes. Touching the patient's eyes with hand sanitizer can cause painful burns. If you have any skin rash or open cuts on your hands, please wear gloves. Each room has an eye chart that says, Eye test chart for 10 feet, and the exam rooms are about 10 feet in length. At the foot of the bed is an extension for the patient's legs. There is also an extension with a small step stool for the patient to step on or off the table. The computer in the room is for the standardized patient's use only. If you have any problem with the equipment in the room, open the door, wave to the proctors, and ask for assistance. They will be happy to help you. Do not leave the room until you have completed the patient encounter. Concluding the patient encounter. After 10 minutes, you will hear a 5-minute warning announcement. There are 5 minutes remaining in this patient encounter. After 15 minutes, you'll hear an announcement. This patient encounter is now over. You must now leave the room. Upon hearing this announcement, you must leave the room immediately. Failure to do so may be considered irregular behavior and will be reported. Be sure that you have all the information that you need before leaving the room, because once you have left the room, you are not permitted to return. If you have left something behind in the exam room, notify the proctors and they will be happy to go back and get it for you. You may not go back into the room yourself. Doing so may be considered irregular behavior and will be reported. After the patient encounter, you will complete the patient note. This is the medical record for documenting the information you obtained during the encounter. Write only the information you elicited from the patient through either the physical examination or history taking. Do not list examination procedures you could have done or questions you might have asked. You'll have 10 minutes to complete the patient note. If you leave the room early, you may use the additional time for the note. A countdown clock in the upper right-hand corner of the patient note displays the time remaining. Please be aware of the progress bar at the bottom of each field. It will let you know how much space is remaining while you are typing. If an error message appears, contact a proctor immediately. Patient notes are automatically saved and information should not be lost if there is an error. 2 user-adjustable display features, text magnification and color inversion, are available in the patient note program. The invert color feature changes the color of the text and background from black on white to white on black. To select this, click the invert color icon. When you do, The background will become black, the text will become white, and the caption of this button changes to revert colors. Clicking the button again will revert the colors back to the normal state. If you would like to enlarge the text of the patient note, click the Magnify Text icon in the upper right-hand corner of the patient note. The Magnify Text button starts the magnification mode. The entire screen magnifies with the initial click on the button. Move the mouse around the screen to view the portion of the application that is not visible on the screen. The screen pans in the direction of the mouse movement. The magnifying glass appears on the screen when in magnification mode. Click the magnifying glass to view the magnifier window. You can use the plus and minus buttons in the magnifier window to zoom in or out. The magnifier window disappears and changes back to a magnifying glass after a few seconds when the mouse is moved away from the window. Closing the magnifier window with X closes the magnification mode. You may return to the normal text size by pressing the Normal Text button. You may use both the magnify and color inversion features simultaneously. You may refer to the examinee instructions while completing your patient note. Click on the Examinee Instructions tab to view the examinee instructions. If at any time you need assistance with the patient note interface, please raise your hand for a proctor. If you think that documenting vital signs is important for the case, use the vital signs provided in the examinee instruction sheet. Try to be as specific as possible when you are documenting the elements of the physical exam, and try to avoid simply writing the term normal. For example, if you find equal sensation bilaterally on a neurologic exam, write that instead of neuro exam normal. List up to 3 diagnoses in the order of likelihood. Although there is room to list 3 diagnoses, not all cases require 3. Write only diagnoses that are reasonably supported by the patient's clinical presentation. If you want to change the rank order of your list, click on the arrows on the left of the screen. Fields for listing the history and physical findings that support your diagnosis are located below each diagnosis. To add more rows, click the Add a Row button. The diagnostic studies should represent the initial tests you would like to use to narrow down your differential diagnosis. Examples include blood tests, X-rays, CT, EKG, urinalysis, and diagnostic procedures. Try to be as specific as possible when ordering diagnostic tests. CBC, electrolytes, and urinalysis are fine, but not the more general terms such as metabolic panel. Use your clinical judgment when selecting initial studies to evaluate the diagnoses that you have listed. For some cases, no diagnostic studies are required. The diagnostic studies you list should not include therapy or management, so they should not include drug treatment, therapeutic procedures, or operations. Nor should they include consultations, referrals, or dispositions such as admit patient to hospital. A list of acceptable abbreviations will be available during the exam. These are abbreviations that patient note readers will understand. The patient notes are read by practicing clinicians, so use your judgment. When in doubt, write out the word. You will hear a warning when there are 2 minutes remaining for the patient note. You have 2 minutes to complete your patient note. 2 minutes later, you will hear, "Examinees, the patient note portion of this encounter is now over. Please stop writing and place pens on your desk. Give your written patient note and blue scrap paper to the proctor." Your typed patient note will automatically be submitted at the end of the 25-minute encounter time, and you will not be able to continue typing. Occasionally, due to technical or administrative problems, you will not be able to type the patient note for 1 or more patient encounters. When this happens, examinees will be required to write their patient notes by hand. All examinees should be prepared for the possibility that they will have to write one or more patient notes by hand. If you are writing the note by hand, stop writing immediately when you hear the announcement to stop writing. Stay seated as the proctors collect all papers used for that encounter. The blue scrap paper is shredded and not used for any type of scoring. Do not continue to write after the announcement to stop has been given. If anyone is observed writing after the announcement has been made, the administrator on duty will be informed and a report will be submitted to the USMLE. This may be considered irregular behavior.
Doctors, please stand and move to your next exam room.
Remain seated until the proctors tell you to move to the next station, and wait until the announcement tells you to start the next encounter. If you require an unscheduled break, please notify a proctor. The exam will continue as scheduled, and you will not receive back any time you have lost. At the end of the exam, you will be asked to complete a brief survey. Your responses will be strictly confidential and will not affect your scores on any step administration. All patient encounters are monitored. There are video cameras and microphones in each examination room. The recorded information is used for quality assurance, training, and research, but is not used for scoring. You are prohibited from discussing your examination content with anyone by any means, including in the hallways at the center, in study groups, or on the Internet. If you are found to have sought, provided, or received secure examination content, your score may be invalidated and you may be barred from taking future examinations. Before the exam begins, a staff member will be available to answer your questions. Remember, when in doubt, just do what you would in a real patient encounter.